Okay, thank you everyone for being with us today. We're really excited about this webinar. We're going to be talking today about Latinx survivors with some specific emphasis on rural settings and how that might affect a sexual assault medical forensic exam. My name is Nicole Broder. I'm the Sexual Assault Nurse Examiner Coordinator with the Oregon Sexual Assault Task Force, and I'm really excited today to be presenting with Claire Barrera from Proyecto UNICA, and I'll let her introduce herself a little bit more here.
Hi everyone, this is Claire Barrera, as Nicole said, and I work with Proyecto UNICA, which is a dual domestic and sexual violence intervention and prevention program based in Gresham, Oregon. And I currently work here. I've worked with UNICA for about 7 years, primarily in our sexual assault services. I manage and oversee our sexual assault prevention program and our sexual assault community health worker. And I also just do a lot of training and community networking here at UNICA, and I'm really excited to be here today.
Feel free at any time, if you have questions, feel free to use the question tab or the chat tab. We'll try to keep an eye on those and may ask you to participate at some point. So our objectives today with this webinar, first of all, we're going to be talking a little bit about the intersection of rape culture and racism, because that's something that we really find when we're working with Latinx survivors in these exams, and really survivors of any minority in the U.S. with these exams. They bring trauma from both of these aspects, and it's really important to understand some of how that works and some of how that may make things a little bit more complicated or just more nuanced in your work. We're also going to talk a lot about barriers that rural Latinx survivors might experience and how to address those barriers in your community. And we're going to end with some tools and resources to support Latinx survivors so that you can really make this exam individualized, which of course is our goal to do with each of our patients.
So whenever we talk about working with a specific community, I think that there's some terms and ideas that are useful to go through. And often people will ask me why I choose the term Latinx, which is very complicated. So I wanted to talk with you all today about some of the terms that you might be hearing out there. So what's the difference between Latino, Latina, Latina with the arroba, with the @ symbol, Latinx, and Hispanic. And that's a complicated history. So one of the differences that we can initially start talking about is the difference between Hispanic and Latino. And Hispanic is really a term that was coined when the United States Census was created. And it's a term also that was popularized by the Reagan administration in the 80s. And that term is very much a term that is identified as applying to people with Spanish ancestry. And so a lot of folks, particularly Latinos born in the United States, don't prefer that term because they don't feel like it represents their Latin American roots. It really just represents Spanish roots. And Reagan really used that term, the Reagan administration really used that term as a way of dividing white Latinos from mixed Black and Indigenous Latinos, and creating sort of like a class difference and color difference between those communities. So the term Latino, Latina, was created, and it comes from within communities that are either from Latin America or are descended from people who come from Latin America. And so in our agency, we tend to use that term because it has a political connotation to it that is empowering for our community. After a while, starting kind of like in the late 80s and 90s, the term Latina with the @ symbol came in as a way to neutralize gender, because as many of you probably know, Spanish is a Romance language and it's gendered. And so people started using in the written form the @ symbol at the end to not always default to the masculine. And then finally, in the last 5 to 10 years, the X at the end of Latino, which we say as Latinx, has started coming into popularity as a way of reflecting that people of all genders exist, not just men and women, not just the A or the O at the end of Spanish words. So that's kind of a brief history of where those terms come from. And I choose to use Latinx because it resonates with me for those political reasons that I mentioned. However, when you're working with people, it's always important to refer to people by the word they use for themselves. So for instance, many of the survivors that I have worked with say Hispanic or Hispano, because that's a common phrase or term that people use when they're coming from Latin America directly as first-generation immigrants. And I'm always respectful by referring to people by the identity that they are choosing for themselves. Another identity that people come in with that I think is important to understand when you're working with any immigrant population is what generation of immigrant they are. And that's because people have very different experiences and different barriers and resources available to them depending on what generation of immigrant they are. But I always found that confusing until I delved a little deeper into it. A first-generation immigrant is the first person to come from a country not the U.S. to the United States. So if somebody is born in Mexico, and they immigrate to the United States, they're a first-generation immigrant. If they have children that are born here in the U.S., their children are second-generation immigrants, and their grandchildren are third-generation immigrants, etc. So it's good to know that because we may be working with Latinx folks from quite a few different generations. Obviously, at this point, there's 4th, 5th, 6th generation immigrants, and they may have very different experiences as survivors based on what generation of immigrant they are. So it's interesting to think about who the Latinx community is in the United States these days. So this census is obviously a little old, and I'm sure many of you have been hearing about how our next census is coming up, and there's been some discussion about whether they're going to ask people if you are an immigrant on that census, which is an interesting conversation. But the information we have from the census from 2010 is that 16% of the U.S. population at that time was identifying themselves as Hispanic or Latino and Latinx. Of course, the options at that census time of how people could identify were a little bit simplistic, and so it could be that that number is off because people may not be able to identify themselves with the options available. And that number has obviously also grown since that time. In the United States, at that time, 63% of immigrants or people who identify as Latinx or Hispanic were of Mexican origin. And overall, 3/4 of Latinx folks in the United States are either Mexican, Cuban, or Puerto Rican in origin. And in Oregon, it's a little bit different from the rest of the country. Some things are similar and some are different, but it's useful to look at that as well. So the population in the state as of 2014 was about 473,000, which is about 12% of the state's total population. So it's pretty big. In terms of rural communities, Latinx folks in Morrow, Malheur, and Hood River counties account for about 1/3 of those populations. So it's actually higher than the state's total. So there's a lot of Latinx people in rural Oregon, and that's often because of the type of work that folks are doing in those areas, and also people coming to join their family in those areas. 64% of Latinx people in Oregon are US born. So we're seeing a lot of people, like we mentioned earlier, of that 2nd, 3rd, 4th generation who still identify as Latinx. And I think that's important to remember because sometimes we think if somebody is born here and speaks English, it's not important to understand their cultural context, but it is still very important. In Oregon, the vast majority of immigrants or Latinx people identify as Mexican or Mexican American. The median age for Latinx folks is 24.3 compared to 41.1 for the white population. So it's a very young population. And in terms of that, the survivors that you might see coming in might also tend towards the young side. White Oregonians have a median household income of $51,000, and Latinx Oregonians have a median household income of $39,000. So there's a significant difference in terms of income and class between Latinx people and white folks. So we're working with a population that experiences more poverty and comes from a working class background or raised poor background. And additionally, 41% of Latinx people did not complete high school, as opposed to 9% of white people. So we're also seeing that we're working with a population that has less access to education. Many immigrants from Latin American countries did not have access to much education. And we'll talk a little bit later about what kinds of barriers might occur in the hospital setting as a result of that.
One thing I want to point out here is if you look at that median age of around 24 years old, and you think about the age range that we know is at the highest risk of sexual assault, the teens and the 20s, and you think about the significant proportion of our population that is made up by Latinx, it just gives you something to think about as far as kind of the proportion of your survivors that you might be expecting, or your patients, like kind of going between different words, who you might expect to be Latinx. And yet, in my experience as a SANE, and I know many other people's experiences as SANEs, the majority of our patients tend to be white. And so thinking about that in the terms of barriers and barriers to accessing care in the first place, I think just really highlights how important it is that when someone comes in to see us, that we are removing as many barriers as possible.
Yeah, so a little bit more about Latinx community in Oregon. We already talked about median income, so we don't need to repeat that. So the last one on here that we haven't talked about is the health insurance thing. So about 88.9% of Latinx folks have health insurance, as opposed to 95.9% of white people. So we're also going to be working with patients who have less access to medical care. And we'll also talk about how that might play out, again, in terms of barriers. And as Nicole said, it might explain something around why fewer people are coming in to receive healthcare after a sexual assault.
So just reviewing a little bit about rape culture, and I know this is something that we all work in already, but again, just really important to review this stuff given that this is just one layer that we're going to be talking about. Rape culture, it kind of surrounds us, and it's the way in which sexual violence is common, and the way in which our media, our social values, our laws, just social attitudes really normalize this violence. And so we all grow up in this rape culture that is very victim blaming, that looks at how people can avoid being assaulted rather than how we can teach people not to assault in the first place. And just keep that in mind as we're talking about a lot of these other barriers and a lot of these other social stigmas and social attitudes that affect the lives of our patients. So a few characteristics of rape culture. One is sexism. So, treating women or female identified people as second rate, as people who are not as talented or as worthy, can't be in leadership positions. I'm sure that you've all talked about the difference between a girl ends up being bossy, whereas a boy is assertive. Those kinds of things all come into play in how we end up experiencing this rape culture. Objectification, of course. How many of us have seen ads using, sexy, scantily clad women to sell their product, even though the product has absolutely nothing to do with a woman or her body? And that plays into a lot of violence as well, and the objectification of that violence towards women. And then, of course, victim blaming, that, oh, what were you wearing? Were you drunk? And we see that internalized so often in our patients, where they come in and they're seeking help, but they still feel like they could have prevented the assault in the first place, and that they may not get support from their family or their friends when they experience very normal aspects of neurobiology of trauma, where their memories may be out of order or scattered or hard to access, where that then gets pinpointed as a sign that they're lying or that this is just regret sex, or they're trying to get back at someone. And of course, how many of our would-be patients never come in the first place because of that victim blaming, because they have internalized that message that it's their fault and that therefore they don't deserve help.
So we're going to talk a little bit about how racism and rape culture intersect to make experiences for Latinx survivors unique. And I think the interesting thing about racism is we can talk about a culture of racism as similar to a culture of rape, right? Like a culture of racism is a culture where the laws, the media, the values of the society normalize racism. And we see some of the same things, right? We see a belief that people of color are less than or second class. We see objectification, so we see the dehumanization of people of color. They're like animals, they're not real humans, that kind of thing. And we see victim blaming. So when, for instance, a person of color reacts to racism with anger, we say, well, look, see, they are animals, they're angry all the time. So we see a lot of these similar shared characteristics. And for Latinx survivors, they're really bearing the brunt of that culture of racism and culture of rape in their experiences as survivors of sexual violence. So I have a few examples here for us to analyze together to see how racism and rape culture intersect. This is a meme that was being passed around the internet about a year or so ago. And as you can see, it really perpetuates these ideas both within the Latinx community, but also to mainstream US community, that the woman is there for sex and food. So it really reinforces and reifies these ideas that women are not people with their own thoughts, their own needs, their own desires. And sorry for that. We're getting your message that you can't hear me speak, so I'm going to try speaking a little closer, but please type in again if you still can't hear me. So as I was saying, we can see that this meme that was being passed around really reinforces this idea that women and Latinx women are here for the pleasure of men, that they are servants, that their job is to provide food and sex to men. And I also think it reinforces stereotypes about Mexican men as more aggressive, as more sexual. And so this meme could very well have come from within the Latinx community, and it is my assumption that it has. And I think it's important for people to hear that, to understand that within the Latinx community, we have our own brand, right, of racism and rape culture. We have those in our own community, and they manifest in unique ways to our culture, but also that these reinforce also like dominant and white ideas of who Latinx men and women are. I chose this other image as an example of rape culture and racism. This is an image that comes from the artist Jesus Huelguera. Jesus Huelguera was an artist in the 20th century, in the early 20th century, and was very popular at the time, but he's still very popular. So you can often see his work shared around both in Latin America, in Spain, and in the United States. It's very, very popular work. It was during his lifetime, and it is now. And he made a lot of these paintings that very much glorified both modern Mexican culture at his time. He was a Mexican artist, both in his time, but also Mexican history. And he had this sort of pinup style that he popularized with his work. And he often painted these paintings where Indigenous women are unconscious and highly sexualized, and where Indigenous men are also highly sexualized, but in a much different way, as like hyper strong, hyper masculine, hypersexual,
There's also images of like conquistadors, sort of like in that hypermasculine role with Indigenous women. And I think what's striking about this and is important to notice is that the woman as an unconscious actor is very sexualized and romanticized. So her inability to act and her lack of agency is seen as sexual and romantic. And sort of like the violence of the male towering over her is also sexualized. And this is something that we see a lot in all rape culture, but in Mexican culture has a unique role in terms of how Indigenous women in particular, or women with different skin tones, are seen as, are objectified even more. And it's something that has carried over to the way that rape culture and racism plays out in the United States, who are also consuming these types of images where Indigenous people are romanticized and dehumanized, and where Latinx identified people are hypersexualized. So Latinx people, especially Latinx women, are seen as being more sexual, which is often used in victim blaming ways, right? So it's like, she wanted it, that's how she is. They're more rapeable in that sense, right? And those are the types of stereotypes that Latinx women and Latinx people in general are coming up against. And I think this is our final example of rape culture. So we can see racism in rape culture. We can see here, this was easy to find. All I did was type into Google, I think, Mexican, Mexican like sexy costume, right? And this is a phenomenon we see a lot, is that people's cultural identities are turned into costumes in Halloween for white consumption. And we call that cultural appropriation. In this case, I think we can see a way that cultural appropriation and rape culture intersect. So I looked at a bunch of different things, and this one was really striking to me because Day of the Dead in Mexico is a spiritual holiday wherein the ancestors that have passed are considered to be close, and there's many rituals associated with that day. People go to the graveyards of their families, they paint, there's parades, people do face paint to look like skeletons. And here we see that that religious holiday has been turned into a costume, and not just a costume, but a sexy costume. So we can see that important cultural norms that are also, again, often associated with more Indigenous communities have been turned into a sexy costume that white people can don or non-Latinx people can don, which reiterates this idea that Latinx people are both not human, so they're not deserving of sort of the respect that perhaps a religion of a white community would be given. And also that we're hypersexualizing the brown woman here. So we're seeing the brown woman as more sexual, hot, spicy. You can kind of see it in all the language around this advertising. I think it's important to talk about the ways that racism and rape culture really are entangled, and the ways that they perpetuate each other. So we probably all know from learning about US history and history of the Americas in school that rape was a very important tool of colonization in all the Americas, right? So colonialism used rape as a tool of conquering people. How is rape a useful tool when you're conquering a people? Well, you're obviously creating trauma, so it's much harder for a group of people to defend themselves, to maintain their cultural norms, to maintain the health of their community when there's trauma. Also, you're destroying family structures. So when women or children or even men are being raped, you're breaking up family structures, whether those are more traditional family structures of men, women, and children being together in community, or non-traditional ones, you're breaking up families. The other ways that, in particular in Latin America, colonizers used rape as a very effective tool is to make communities more white. So when you're raping indigenous communities, and there's mixed children being born, you're forcing the dilution of indigenous blood, and that makes it much harder to maintain community. So it's important to remember that rape was a very conscious tool of colonialism, and it still is. It was a tool of genocide and cultural imperialism. So forcing your culture onto another culture and forcing that indigenous culture to be lost. Why is it useful to think about this? Well, for one thing, we can think about generations of trauma. So when we're working with Latinx survivors, we are guaranteed working with folks who have generational trauma in their background. And many of you may have heard of more recent research around epigenetics, which is the study of how our DNA reflects our ancestry and our history, right? And what they've found is that there are ways in which we pass down trauma on the DNA level to the people we give birth to. And so we can see that we're working with people who not only may have their own present day trauma, but they're also carrying markers of trauma from their ancestors. And I think that happens both in the DNA level, but it happens in terms of memory, right? Like many of us might know the histories of our ancestors, and that might include generational sexual trauma. Another thing to think about in terms of the effects of racism and rape culture and their intersection is that oppression is trauma. It's easy to lose sight of the fact that not only are people of color and Latinx survivors that we're working with experiencing the actual trauma of the sexual assaults that they've experienced, but that they are bringing with them racism as trauma. So again, there's been many studies that show that things like microaggressions amassed over a lifetime have the same effects as a violent incident such as a sexual assault. So they have the same effects on the brain, on the nervous system, things like memory, ability to focus, all that kind of stuff that we see as a result of sexual trauma, we see as a result of racism. So pretty much guaranteed that when you're working with a Latinx survivor, they're a survivor of complex trauma, even if their sexual assault was a one-time incident. The other thing we see at the intersections of racism and rape culture is increased vulnerability. So we know that, for instance, women, because of rape culture, are at higher risk of sexual violence. But we also know from what we just learned that people of color are at higher risk of sexual violence, because rape is a tool of racism and colonization. So we're pretty much always seeing populations when we're working with communities of color that are increased vulnerability for sexual violence. So let's look at some of the actual statistics around sexual assault in Latinx communities. There's unfortunately very little studies that have been done that are specific to Latinx populations. The most significant that was done, I feel like 4 or 5 years ago. And it was called the SALAS study, which stands for Sexual Assault Among Latinas study. And so again, this is not reflective of all genders either. It was very specifically to working with female identified Latinas. In that study, about 17.7% experienced sexual assault. So what we see is that overall, there was a pretty similar incidence of sexual violence as the general population in the United States, but there are some deviations, and I'll talk about that in a minute. Only 21% sought formal help. So compared to mainstream, it's usually lower. Very few Latinas are seeking formal help through systems such as the police, therapy, things like that. However, 58.3% sought informal help. So this is a community where survivors are really reaching out to friends and family. And we'll talk a little bit later about some of the cultural norms that may perhaps contribute to that difference between seeking formal and informal help. Interestingly, being an immigrant is associated with a decrease of odds of sexual victimization. So that means that people who are first generation who came to the United States from another country are less likely to be sexually assaulted than Latinx identified people who were born in the United States. And nobody knows for sure exactly why that is, but one of the biggest theories is that being acculturated increases your odds of sexual victimization. So there's some kind of protective factor about being an immigrant and having connection to your culture of origin that is not quite there for folks who are living between multiple cultures and are perhaps experiencing some dissonance between those cultures, having been born in the US, but also being connected to Latinx identity.
So looking a little bit at rates of sexual assault in rural settings, and unfortunately there are no studies that we could find that look specifically at sexual assault involving Latinx survivors in rural settings. So we have these two kind of separate things that we're looking at here. But what we could find as far as a 2014 report from the National Center for Victims of Crime was that the sexual assault rate in urban settings was listed at 1.8 out of 1,000 people, whereas the sexual assault rate in rural settings was about half that, so 0.7 out of 1,000 people. But then looking at reports to police, urban victims were less likely to report to police than rural victims. There's some interesting things to keep in mind here. I was actually pretty surprised when I looked at these statistics, just because from working with our rural communities in Oregon, I know that there's kind of this duality that I've encountered. On the one side, I've heard people feel much more connected to their community, to their law enforcement, just that sense of community in general, which makes sense that more victims might report to police. But I've also certainly heard from some of our rural practitioners and from rural patients that because things are smaller and we run into privacy issues, which we've discussed in a different webinar, that sometimes people are less likely to report because they don't have that feeling of anonymity. There's more fear around their family and friends and community finding out about it. So just some interesting statistics to keep in mind here. And keeping in mind that sort of balancing act between community and possible privacy issues when we're looking at some of the barriers that our Latinx survivors encounter.
So let's talk a little more in depth about some of the barriers that patients that you're working with might have to either leaving a sexually abusive situation or seeking support. So we talked a little bit earlier about how the median income for Latinx identified people is lower than for white populations. So let's talk a little bit about financial challenges. So we're going to be this community will be a community where there's less access to financial resources. And I'm going to go ahead and talk a little bit about undocumented status, even though we'll get to that a little bit later, because it really intersects a lot with this idea of financial challenges and why that's an issue for Latinx survivors. So undocumented immigrant folks clearly have a lot of less access to financial resources. That comes in the form of not having ability to find legal work. And we know that even if people are able to find under the table work, that those jobs are going to pay significantly less. Also, federal benefits that might be available to low-income folks who are documented will not be as an option because you do not qualify for things like SNAP or TANF if you are undocumented. Additionally, doing things like opening a bank account, savings account, those things can be really difficult when you are undocumented and don't have the proper identification and paperwork. So in general, and especially rurally, we're going to be working with a population who has a lot of financial barriers to getting safe, to receiving services. And so next here we have legal status, which I was just talking about, right? So that undocumented status is a huge barrier in multiple ways, right? Not only is it a barrier financially, as I already mentioned, but it puts people in a position of fear. So people without documentation are going to be more afraid to seek support in systems because, especially in today's climate, there's a huge danger of deportation. separation from your family. And often, as we know, abusers use that as a threat if they're wanting to maintain power and control over a survivor or expect the survivor's silence. They'll threaten to call immigration on a survivor to maintain that silence or maintain that power and control. And there's other resources that are not an option for somebody who's undocumented. And there's also just discrimination. So being concerned that their undocumented status will cause them to experience discrimination across multiple systems, right? Because there's a lot of rhetoric right now in the community that immigrants are trying to steal our jobs, that they're making our communities poorer, dirtier, that kind of stuff. So there's a lot of discrimination associated with undocumented status. And even for folks who aren't undocumented in our Latinx, there's often an assumption that people are undocumented or people have family members that are undocumented. So even folks who are documented are experiencing barriers because of those beliefs that are spread out in our community right now. Another big barrier for Latinx survivors is discrimination and specifically racism within systems and institutions. So many of the survivors I worked with report to me that they did seek help in the past or in the present and experienced discrimination and racism within systems. So they were maybe discriminated against for the color of their skin, for not speaking English as a first language, for being undocumented. They were denied services or they were treated differently because of that. They were treated with disdain and not given access to the same services. And so a survivor may choose to not reach out at all because of that, because they've had experiences in the past, or perhaps they've heard in the community of other people having those experiences and they don't feel safe because, as we talked about earlier, oppression is a form of trauma and we don't want, and survivors are seeking to not experience more trauma. Language can be a huge barrier in Latinx communities. So when we're working with folks who have no English or maybe have English as a second language, they may be concerned that, and often rightly so, that if they go seek services, they will not have access in their own language and they will not be able to communicate what they need. And we know that, because of the neurobiology of people in trauma, the access to different parts of their brain, particularly maybe the ability to speak in another language, which is a pretty complex mental operation, will be even more limited. And we know that survivors really need to be able to communicate well in their most comfortable language in times of trauma, when doing things like making reports or explaining something to a nurse. And so they may choose not to reach out and get help because of that, or if they do reach out, they may come across a lot of issues. So, for example, another issue that we have is interpreter issues. So we often see that police or hospital staff or social services are hesitant to call interpreters. They don't like using interpreters. They're annoyed about having to pay for it. They feel that paying for it is not a good use of their finances. And so they may ask survivors to have a family member interpret, which is, of course, very inappropriate. In addition, we might see that an interpreter is not good at their job. So there are no actual required certifications for somebody to be an interpreter. And different companies who employ interpreters have very different standards for what they think qualifies as a good interpreter. And so we find that interpreters don't do a good job sometimes, or they haven't been trained on how to be professional. So, for instance, I met with a survivor in a hospital where the nurse was asking the survivor if they wanted a prophylactic, and the interpreter began giving her opinion on what the survivor should do. And I had to interrupt the interpreter and say, that's not your role. Your job is just to say what each person in this room is saying in the other language. And you don't get to give advice, medical advice to the client, to the patient, excuse me. So
go ahead. Go ahead, Nicole. And keep in mind too that interpreters are still people. And so something that will really help your patient in the long run is to keep that in mind in terms of the fact that the interpreter may have triggers, may have biases, things like that, that they may bring into the interpretation. And so while, of course, whenever we're working in the medical setting, we're always striving to use interpreters with our patients who don't speak English as a first language, sorry, I was just looking at the question that came in, and we will address that in a second. Thank you. And so to keep in mind that, they may have triggers that they bring in, so you might want to bring up before the interpretation starts that this is going to be a conversation surrounding assault and sexual abuse, and is that something that they feel comfortable with? If your interpreter is being triggered and having a breakdown on the call, then that doesn't help anyone in the situation. Doesn't help the interpreter for sure, doesn't help your patient, and of course doesn't help you then take care of your patient. So try to work with, if there is some sort of certification number or something that the interpreter has, sometimes that can be an indication that they've gone through a specific course. But whereas I know that sometimes in the medical environment, we skate by sometimes using family or friends to interpret because we're all in busy environments and we're trying to do the best with what we have, that really is just not a good option here as well. Keep in mind too that if someone speaks really good Spanish or really good English as far as who's interpreting, they may not know specifically medical Spanish or medical English. And if you think about how difficult of a time sometimes we have with our patients who do speak English as a first language and explaining some complicated medical things to them in English, then it really becomes clear how important it is to have someone with really specialized training. I found myself in a situation a few weeks ago explaining the HIV NPEP process, those prophylactic medications to prevent HIV transmission through an interpreter phone. And for some reason, that was the first time that I'd actually encountered that situation. And that's a conversation that's already really difficult in English. And then adding in the time and the lag, it just really made me appreciate those challenges. And so again, just making sure that we have someone with as much qualifications as possible.
So we're seeing a question here from a participant, thank you. It says, if a sane nurse speaks Spanish, can we speak to the victim in their preferred language? What is the legal aspect of that? Do we have to become certified even if Spanish is our first spoken language? So the certification is really for interpreters, and you wouldn't need to worry about that. Definitely, we would love to have more nurses who speak Spanish because the less intervening folks, the better. So if you speak Spanish fluently, particularly if it's your native language, you can definitely speak directly to the survivor in Spanish. You may, if you know there's like a third party presence, like another hospital staff or the police come in, you'll still need an interpreter present, right? Because you shouldn't be doing both interpreting and your job as a sane nurse. And so that's when you'd want an interpreter in there. And perhaps the interpreter will then be interpreting both what you say and what the patient says to the officer or to the other hospital staff. And that's fine. That's often, as an advocate, what I do as an advocate who speaks Spanish. And if you're not a native Spanish speaker, just remember that just because you think you speak fluent Spanish doesn't mean the person will be able to understand you. So also just being humble about our Spanish skills. You know, I'm third generation Latinx, and it's taken me time to build my Spanish up to where I want it to be. And so I've had to be humble sometimes about, like, as Nicole is saying, in settings, especially as specific as medical settings where you need to know very specialized terms, making sure that you have interpreters there who can help with some of that unique language.
If you are planning to do a lot of the conversation on your own, I would highly recommend taking a course specifically in medical Spanish. Again, just from that sense of, like, a lot of people who speak English as a first language may not know a lot of the medical terms that we use. A lot of people who grow up with Spanish may still not know a lot of the terms that you need to access in Spanish. And so making sure that you're kind of taking courses and keeping up that specific terminology that you need, both to ensure that nothing's getting accidentally lost with the patient, and then also thinking ahead to if you end up being called to testify for that case, you would definitely want to have good backing that, yes, you know that your interpretation, you're not interpreting for yourself, but that your communication with the patient was exactly what you intended it to be, and being able to show that education is really helpful and important.
Okay, so of course you all already know this next one, emotional distress from surviving trauma can get in the way for people. That's true of all survivors, regardless of race or ethnicity. That being in shock, being dissociated, things like that can be a barrier to seeking support. Because of some of the financial challenges we mentioned earlier, Latinx survivors can have barriers related to insufficient food, clothing, and basic needs. Which can make it hard to get safe and reach out and maybe make a change in terms of getting away from an abusive situation. So isolation is a major barrier, and that really is particularly true for people at the intersection of Latinx identity and rural living. So because Latinx communities are still a minority community, and immigrants are coming, to parts of the world, parts of the country where they may not know anybody and where the Latinx community is small, isolation can be a huge barrier. It can be really hard to reach out, seek help, know what the services are available when you live in a rural area where perhaps there's no Latinx specific options, or maybe there is a Latinx specific option, but everybody's going to know your business if you reach out because the community is so small. Lack of transportation is another barrier for folks in Latinx communities, especially rurally where there maybe isn't even public transit available. People may not have the money or the driver's license to transport themselves, have their own vehicle. They may not understand the transportation system, even if there is a public transit system available, and they may not have that ability to easily navigate in the correct language to get around the way they need to. We talked earlier about how Latinx communities are less likely to have higher education and high school diplomas. So literacy is a big issue in our community. Many of the survivors we work with, particularly if they're first generation immigrants, may not know how to read and write at all or well enough to be able to fill out paperwork, read pamphlets on where to get support, understand their rights in terms of the medical exam. And so that can be a huge barrier. And a great way to address that barrier is to always ask people if they would prefer if you read things out loud to them and explain things to them, because that can be a big barrier. Knowledge of laws or systems is a big barrier for people. So if people are immigrating here from another country, or if people are the children of immigrants and so didn't have that support from their parents to understand how laws or systems work, they're going to have less ability to access those systems or to know what their rights are. And particularly right now, the immigration laws and just laws in general via Trump administration are changing like every day. And personally, as an advocate, I already have a hard time keeping up, let alone folks in the community who have less access to the education and skills to be able to navigate those systems. It's very challenging for people to know what's true and what's not true. And what we find a lot in rural Latinx communities is that the rumors fly like crazy. And also that there are people out there, not great people, waiting to capitalize on that. So people will create like pyramid schemes and stuff to capitalize on the lack of knowledge and all the rumors that are flying around the community and spread those rumors around in order to like get money out of people, for instance, saying like, oh, I can help you with your immigration status if you do this. And so there's a lot of barriers and even like actively criminal things happening because of the lack of knowledge of laws and systems in the community. We are also learning about how the community is very young. So there's a lot of kids in our community, in Latinx community, and a lack of childcare is a huge barrier to services, whether that be going to support group, going to get a medical exam, going to talk to the police. Not having support in terms of your kids. If you have 5 kids, like trying to go somewhere on a bus with those kids, trying to go get a medical exam is going to be very difficult. In the community, a lack of trust or a fear of the police and other authorities is huge. We already talked about how there's a big fear of immigration, and there's a long history of police and other authorities collaborating with immigration to get people sort of funneled into the immigration system when they come to those authorities. And so there's a lot of mistrust in the community of police, and there's a lack of knowledge and understanding of what those different authority figures can do or will do. And in addition, of course, people have actually experienced racism and discrimination on behalf of many authority figures, and so that contributes to the fear and mistrust. We also talked in that rape culture section about just stereotypes about the Latinx community in general. And so often there's a desire to protect the reputation of the community and not contribute to stereotypes about people of color being more violent, being more animalistic. And so sometimes survivors don't want to come forward because they don't want to contribute to racism against their own community. And that kind of goes along with stereotypes, right? And so this, for instance, if you're a male survivor of sexual violence, you may know that there's this stereotype that Latinx men are strong and hypersexual, macho. And so you may feel that you will not be believed if you come forward knowing that other people who outside of the community may have those stereotypes about you. So we know that these stereotypes actively contribute to survivors being afraid that they will not be believed or that they will reinforce stereotypes if they come forward. We already talked also a little bit about size of community. For Latinx rural folks, the size of the community can be a huge barrier because nothing is private. And if you come forward, there's a good chance that it's going to get around what happened, or that people will take the side of your abuser if you do speak out, because the community is so small, and then your whole support network that you have may disappear for you. And so it may feel safer to do nothing and to not seek out resources than to potentially lose your community or have all your private business spread everywhere. And also just the lack of resources. Even in urban settings, there's a lack of culturally specific resources where people speak your language, where they understand your cultural norms and values. And in rural areas, of course, there's even less access to those things. And finally, I want to talk a little bit about some generalizations around Latinx community. Of course, Latinx communities, both immigrants from Latin America and people living in the US and born in the US who are Latinx identified, there's a huge amount of diversity. There's a lot of different styles, a lot of different beliefs. So, I hate to overgeneralize, but I think it can be useful to talk a little bit about cultural norms. And these cultural norms are both protective factors and supportive factors for people, but they're also barriers at times. So in Latinx community, many folks coming from Latin America and descended from Latin American ancestors have communities where gender roles are pretty traditional. So where the expectations of men and women, which are often the only two genders available to folks, right, are much more traditional. And a lot of that comes out of religion, which we can see at the bottom of this list. So in Mexican American and Mexican community, which is primarily who we're working with in Oregon, the primary religion is Catholicism. And in Catholicism, we know that gender roles are much more prescribed and much more traditional. And there's a lot of beliefs around what the job is of a woman and of a man. And along with that religious belief and influence in Latinx and particularly Mexican culture, we know that the ideas around marriage are very traditional. So you stay a virgin until you're married. So there's a lot of concern for survivors who are maybe raped that they betrayed their marriage, or that they had sex before marriage and that they're not considered a virgin anymore, or they're considered dirty or blemished in some way. Or there's beliefs around the fact that you need to have sex with your husband no matter what, and that your role is to procreate. And so that contributes to a misunderstanding that rape can happen in marriage as well, and that consent is still a requirement within partnerships and marriages. There's also cultural norms around privacy, right? Like the belief that what happens in our community or in our family should stay there. We don't talk about these things in public. We don't talk about mental health. We don't talk about violence in the family. We don't talk about abuse because those are private and those should stay within the family. And just the cultural norms around family and community being so central and so important. We talked earlier about how Latinas tend to seek support in informal ways from community, from the church, from family before they seek it formally from systems. And that's because family is so central. How that plays out as a barrier can be, again, that people don't feel like they can speak bad about their family because family is so important. And also that maintaining the reputation and cohesion of the family, not breaking up the family by talking about abuse within the family or within the community is very important. I want to reiterate just quickly before we move on that these are also protective things, right? Like that a strong centering in family is a huge resource to Latinx survivors. So for instance, many of the folks that I've worked with never have to be homeless because family takes in family. And religion too can be a huge strength. So many of the survivors that I work with say that their faith has been a huge factor in terms of healing from sexual violence, or that they were able to first get help in their churches. So these are not black and white things. These are both strengths and barriers.
Before we move on, we're going to spend a little time at the end talking about case studies, but I just want to give a couple examples of how this has played out, for example, with some of the Latinx survivors that I've seen in the hospital. And the first one is kind of around privacy. And again, as Claire mentioned, so important to not just jump to generalizations and to meet your patient where they're at, again, like with any other patient. But being aware of those social norms and perhaps different ideas around modesty and things like that can help you remember to really be diligent about offering all of the different options that we can offer in the exams, because we do have so many options to make these exams so individual. And so remembering to discuss anything that your patient might want is really important. And what's coming to mind is a woman I talked to who I never actually saw undressed. She came in after an assault. She was very embarrassed about it, but she wanted medical treatment, and she did want evidence collected, but just anonymously. She felt like she probably would never report, but she wanted to leave that option open. And again, I didn't jump to any conclusions with her, and I offered her, the whole wide range of things to work with. But as soon as I saw that she was kind of on that more modest side, that those ideas about cultural norms and especially like religious ideas and things around family came into mind. And so we were able to collect a lot of evidence without me ever getting her undressed or ever seeing her unclothed. And what I did is I was just very diligent about telling her where I would want to collect swabs and talking her through the process of collecting those swabs herself. So again, that's something I could have done with any patient and have in fact done with many patients. But being aware of some of those cultural aspects as well, it was easy to meet her on her level as soon as that started to become apparent. And then another example that I'd just like to bring up really quickly is an underage girl that I saw who came in after sex that she stated was consensual, but because of differences in norms, her family was very concerned about her and very concerned about the fact that she had had sex at such a young age, and so wanted her to come in for this exam. And we had a very in-depth conversation about what the exam entailed and how invasive it can be, and her own thoughts around her own sexual experiences. And she ended up, while she still continued to say that the entire thing was consensual, she also did decide that she wanted to move forward with the exam. And so navigating those dynamics, and especially when I discussed that with some other colleagues later, there was some ideas that I heard about how maybe I should have pushed back more against her family. And for me, it was really important to discuss everything really thoroughly with the patient, but also support exactly where she was at. And where she was at was that she didn't have the same view of her sexual experience that her parents did, but she really wanted that support from them, and she felt like this was the best way to do that. and allowing her to make sure that she had that support and that connection to her family, I felt was a very important part of the process. As Claire mentioned, these things go both ways, and we will see ways in which they can be barriers, but there are also so many ways in which they really enrich the support and the just like emotional resilience and healing of our patients. So respecting both aspects of that is just something to keep in mind.
So we'll talk a little bit about resources, and we recognize that same nurses, they're not doing the advocacy and case management piece, but there are some basic responses that can be useful, particularly if, you have a patient coming in who's experiencing some of these barriers, who's maybe having some doubts. Sometimes providing a little information can help them make a better decision about what they want to move forward with in the exam. So one thing to think about is letting them know or having pamphlets available of immigrant rights, because things are changing so rapidly right now in terms of how we're working with undocumented immigrants in the United States right now and how we're treating them through the law. It can be useful to kind of regularly re-educate yourself by going on this website, the Northwest Immigrant Rights Project website. They publish a Know Your Rights brochure. That's a great 101 in multiple languages for undocumented immigrant survivors, or even if you have survivors who are documented but maybe have an undocumented family they're concerned about. This is a great thing that you can provide them, so they can both be informed of their safety, but also let that inform whether they feel comfortable reporting to the police or not, or getting the exam with you or not. And locally to Portland, but also they have some options a little more rurally, is Immigration Legal Services. So Immigration Legal Services is a program of Catholic Charities Oregon. They're based in Portland, but they do have rural grants, and they can work with survivors who could qualify for visas for victims of crime. There's 3 different visas for victims of crime who are undocumented, and letting survivors know that there is the option potentially to get a visa could alleviate some of their fears around reporting or getting help in different ways. And getting them connected with a lawyer is a great way to do that. And I'm sorry I didn't provide the phone number for them here, but you can look up Catholic Charities Oregon Immigration Legal Services and easily find their website. Some other culturally specific resources that are available to survivors, Latinx survivors of sexual violence, Proyecto UNICA, which is the program I work with. We are, again, based in Portland, but we have one rural advocate who works primarily in Clackamas, in rural communities in Clackamas County. And then we have a crisis line where we speak with people all over Oregon and honestly all over the United States, because our 24/7 bilingual crisis line is so unusual and unique. We do get calls from all over, and we can take calls from anybody and help them connect with resources across the state. And if survivors want to relocate to our area, or if they're willing to travel to meet with somebody, we have no barriers in terms of who we can work with. It's really just kind of comes down to how far the advocate is willing to drive and how far the client is willing to travel, the survivor. And we'll work with people of any identity, but we do primarily end up working with Latinx survivors. Immigrant and Refugee Community Organization is local to Portland, but again, they have some breadth in terms of counties that they can work with, and they survive immigrant and refugee survivors of domestic and sexual violence. It's primarily domestic violence, but they do have been doing a lot of sex trafficking cases, and they will sort of bend their rules to work with survivors. And the Native American Youth and Family Association. Our project, Proyecto UNICA, has been working really closely with Native American Youth and Family Association because we recognize that there are Indigenous Latin Americans who are sort of at this intersection of Latinx and Native identities. And sometimes neither of our projects can serve them perfectly. So we tend to, in those cases, collaborate with NAYA to meet the needs of those survivors. And there's a lot of folks who Spanish is maybe their second language and they speak an Indigenous language, or maybe they don't even speak Spanish and all they speak is an Indigenous language. And it can be useful in those cases to make sure that their service is available to them, both for their Indigenous identity and for their Latinx identity. And all those organizations, you can look and find their websites to refer to them. In terms of addressing barriers as SANE nurses, remember to refer people to culturally specific services when possible or desired by the participant. And remember that just because somebody speaks English doesn't mean they don't need or want a culturally specific service. So if you're working with a second or third generation Latinx person, they may speak English, but they may still want to work with an advocate who gets their culture or who they can speak Spanglish with, right? Like we know that a lot of second generation immigrants, third generation immigrants speak a mix of languages. Another job that you're going to have, and we'll practice this a little bit in our role play, is interrupting oppressive comments or dynamics and policies. So as SANE nurses, we recognize that you're interacting with other professionals such as police officers, other hospital staff, advocates who are coming in to be present with the survivor. And those people may end up saying racist things. They may make assumptions about the survivor because of that. They may be discriminatory. And part of your job may be to gently interrupt those things on behalf of the patient that you're working with and make sure that they're getting treated equally and with respect. And we'll practice that a little bit. Again, securing an interpreter is super important. So if there's resistance on anybody's behalf, on anybody's part, whether it's hospital staff or the police, or even inside yourself around getting an interpreter, remember how crucial that is to survivors getting the services that they deserve and to getting equal access, equitable access to the care that you're providing. And also referring and letting undocumented immigrants know that there are visas available. And you don't have to be an expert on those visas and what they are, but just saying to a survivor, look, you may be eligible for this. Would you like more information about it? Perhaps it will help you make a more informed decision.
Definitely that social workers, hospital social workers might be able to help out with those visas, or would you recommend going directly to some of those organizations that you mentioned?
You know, I would imagine that hospital social workers may not know about the visas. I'm sure some have educated themselves about it, but some may not know about it. So I think whenever possible, giving them that direct handoff or checking yourself with the social worker to see if they're aware of it and can help with it is a good idea. The fewer steps that survivors have to go through, the better. We know that, right? So if you have a direct line to or a pamphlet to hand out to a survivor with legal consultation, I think that's always best. And if you're doing a little bit of safety planning with somebody, particularly before an advocate shows up, remember that doing some safety planning around their immigration status is important. So when we're doing safety planning with survivors, we don't just talk to them about like how to be safe from the abuser, but how to be safe as an undocumented immigrant. And that's where that Know Your Rights brochure can be really useful. Remembering that when we're talking with survivors about how they can take care of their emotional health, making sure that we're allowing for culturally specific coping mechanisms and self-care and healing. And sometimes that looks different in different communities, right? Like what may be acceptable in sort of the white mainstream community in terms of self-care may be very different in other communities, and not just sort of recommending the rote, like take a hot bath or go do yoga. Those things may not be appropriate or even accessible or something that people have heard about or comfortable to somebody who comes from Latinx communities. So really encouraging them to identify, like in your culture, what are things that you do that help you feel better, that help you stay safe, that help you feel comfortable is really important. An example of that is, in some Caribbean cultures, there's spiritual practices that may look like, to a psychologist, they may want to pathologize those spiritual practices as being unhealthy, like talking about ghosts or being cursed as part of what's happened to them as a survivor. There may be a desire to pathologize those things, but like perhaps for that person it's part of their spiritual practice, and that getting healing care around those curses or around ghosts or bad spirits is a healthy coping mechanism within that culture. Doing some safety planning around potential or actual racism. So when I'm safety planning with survivors And I know that we're going to work with police. For instance, I might do some safety planning around, okay, if you're feeling uncomfortable with a police officer, is there a safe word? Or what can you do if something racist starts happening? How can you be safe? How can your young boys in your family be safe if an officer comes around, when we know that men of color get disproportionately criminalized and harmed by police? So doing a little safety planning around that. And really thinking about helping survivors increase support networks to decrease that isolation that we know Latinx and rural folks experience. So brainstorming around where they can increase their support. Is it their church? Are there culturally specific activities in their community that they can get involved in so that they can really reduce isolation?
So we're going to go into a couple of scenarios that we're going to discuss about a couple different scenarios where we're going to discuss the barriers that the client is experiencing and how you might address them, both in the sense of safety, in referrals, immediate response, longer term planning, things like that. So I'm going to go ahead and read this out for you all here. So the first scenario we're looking at is a patient in mid-40s comes in following a sexual assault, Spanish speaking with a few English words. She's with her sister, who speaks English conversationally, and the patient indicates that she wants her sister to translate for her. So you have both a video interpreter and a phone interpreter available, but the phone battery only lasts a couple hours at a time. And so we're going to give you just a minute here, and if you could use either the chat or the question box to just type in a thought or two about how you might address this patient or specific concerns that you have with this patient. We'll give you just a little bit here and then we'll start talking. Okay, so feel free to type in any little thoughts, but we're going to go ahead and start discussing a few of our own here. Claire, do you want to go first?
Sure. So I think, this is a really common scenario in terms of people wanting either a family member to do it or being asked to have a family member do it. And in this case, I think it's important to, validate and honor why this client may want her sister to do it. And then really help the patient understand how that could affect things. So, helping the patient understand how, legally it could affect the evidence collection in terms of making sure that, what's being conveyed by about what happened and therefore how the exam is conducted is correct. And also with the police report, making sure the police really understand what happened so they can make the appropriate charges. These are the kind of details that like can make or break our case or an exam. And so helping the patient understand why having a professional is very important.
We have a comment here that I think is great to share. The suggestion to use the phone interpreter for more technical parts of the exam and medical questions, while the sister can help with less formal parts of the interaction. That's a really great suggestion there. And again, brings to mind an exam that I did once where, actually, first I want to talk a little bit about phone interpreters versus video interpreters. Depending on your facility, you may not have the option between what type of interpreter you get. Depending on your facility, you may also have the option for an in-person interpreter. And so a few things to keep in mind. First, with in-person interpreters, while I prefer those for pretty much any other medical issue, and while it's almost never available to me, generally not the best option for a sexual assault patient, especially because you don't know whether that interpreter may come from the patient's own community. And so making sure to respect your patient's privacy, even if they're not directly from their community in the area, especially depending on if you're in a small place, like we're talking about rural settings here, they may then start seeing them at the grocery store or a yoga studio. I have yoga on the brain now. And so making sure to respect your patient's privacy that way. Video interpreters often seem to run more smoothly than phone interpreters. And oftentimes in many settings, it can be nice to have, the lip reading as well as the audio component. And if you have something like a deaf or hard of hearing patient, then it may be crucial to have a video interpreter. But again, not usually the best option for these patients because of that whole privacy issue and because of the fact that you'll need to be really careful about when that video interpreter can see that patient. And if you have the opportunity to maybe turn it away for other parts of the exam, it's certainly possible to use a video interpreter, but usually not your strongest option. Phone interpreters tend to be the best from the sense of it is more anonymous. You don't have to worry about privacy, either in terms of the patient knowing the interpreter in the community, but also in the sense that if you are uncovering the patient, you don't need to be careful about where that interpreter is at or what it can see. The downside is that sometimes the phone interpreters or the phones for the interpretation are cell phones, and so there may be a battery life issue. And so this brings me back to just the scenario that I wanted to share with you all, where I was doing an exam that ended up taking several hours, about maybe six or 7 hours, and I was using a cell phone interpreter. And I ran through 3 different cell phones, and not the greatest situation, especially in the sense that every time the phone battery ran out, I'd have to leave the room or flag down someone in the hall to grab me a new phone or a new battery. I'd have to call back in. We had to start building rapport all over again with a new interpreter, which my patient rolled with very well. She was incredibly resilient. But I could see many people where that would have been game over. Like, oh, I just told this story to one strange person and now another strange person is going to hear more aspects of my story. That can be really difficult. What helped a little bit was that my Spanish is not good, and it's even worse now. But at the time that I was doing this exam, it was a little better. And while we were waiting for that dial tone to finish and for us to call back in, I was able to make a little bit of small talk with the patient and didn't have anyone around at the time who could interpret for me. So, it was very, very basic small talk, but was able to keep that rapport going between me and the patient during that whole process. And I felt like that was really important. And again, my patient was very easygoing and resilient and responded to that really well. So it's good when you get back to your facilities, if you haven't already, take a look around, see what interpretation options you do have available. See if you have any options with them, like, oh, is your phone Is it just a number that you call in and there's a landline in the room that you can use versus are you using mobile phones? If you have a video interpreter, can the screen be rotated or is it sort of set in a position? Take a look at all those to make sure that you know what your options are should this come up.
Okay. All right, so we're going to move on to our next scenario. So a patient in her late 20s comes in after a sexual assault committed by her boyfriend. She is very nervous and shares with you that her boyfriend told her if she sought help, he would call Immigration and Customs Enforcement and get her deported. She is not sure she wants to go through with the exam.
So for time's sake, we're going to go ahead and just start talking about this. But again, feel free to chime in with any thoughts in the questions box or the chat box.
Yeah, so I think this is one of those scenarios where this patient could really use a lot more information to make a more informed decision, right? So I think talking a little bit about what happens when somebody calls immigration. And, you know, it's a little tricky because a couple of years ago, I could usually pretty confidently say, like, immigration is probably not going to pay much attention if just some random dude calls and wants to report somebody. Nowadays, it feels a little more sketchy because it feels like immigration is more active and more eager to deport people. So doing some safety planning around what her rights are, you know, if immigration comes to her door, what can she do? What are her rights in terms of letting them in or not, that kind of thing. And then also letting her know about the visas. So letting her know that if she reports, she may qualify for a U visa. And getting her connected with a lawyer if she's interested in learning more. And of course, she has the option of reporting to the police later. So if she wants to do a consultation with a lawyer beforehand, she kind of has that right to learn a little bit more about her options before she makes a report to the police.
An anonymous kit is a great option here. To give her time to go through these processes, keep that evidence stored, and let her get in touch with lawyers and kind of figure out what her options are if she does report.
And if you have any specific questions about any of these scenarios as we go along, please feel free to write in.
So our last scenario here is that a nurse at a hospital connects you with a 30-year-old man who's come to the hospital after being sexually assaulted. The nurse is visibly irritated when you arrive, tells you the man can speak English just fine, but will only talk to her in Spanish. And then in front of the patient, she says, our hospital shouldn't have to dole out money to get an interpreter for these people.
This is one of those great opportunities for you to practice your interrupting oppressive comments, bystander intervention skills. And, you know, as SAY nurses, you're often navigating these situations where you both need to push back against another professional, but also do so in a way that's not going to mess up the services that your patient is going to receive, right? So you don't want to get the nurse so angry with your response that perhaps the hospital is not going to treat your client well, your patient well. But you also don't want to let that fly because, of course, what she's saying in front of the patient is wrong and also very harmful to the patient. So doing a little trauma-informed education can be helpful, I think, in these moments. So helping the nurse understand that for somebody who's experienced a trauma, speaking English, even if they speak it well, can be very challenging because our brains aren't working the same way after an abuse, and that being able to express ourselves in our most natural language is going to be very helpful, and also helping her understand that the patient may not be able to say some of the complex things they want to say in English that they would be able to in Spanish, and that can affect the case.
You can also bring in just the more general idea that interpreters for medical care is best practice, and that it's also protective of her license and yours to follow best practice in this scenario. And different people kind of respond to the more human element, like Claire represented. Some require that more kind of legal cover your ass element. And so you can use your own knowledge of someone in that situation to help with, like Claire mentioned, get that education in, but in a gentle way that's not going to just go the complete opposite direction and make everyone's life harder.
I think also acknowledging after the nurse has left the room to your patient that was a really racist thing for her to say at the end there. and that they don't deserve that and they have a right. Just the kind of things you would say to a survivor about their sexual violence, right? Like, you have a right to be treated with respect. That person should not have done that. You did nothing wrong. You deserve to have an interpreter. Those are all very validating and normalizing and healing things to say to somebody. And then you may want to think about whether you want to do some kind of report about that nurse. Perhaps you feel that might jeopardize your relationship with the hospital and you don't want to do that. But thinking about that and maybe talking with your supervisor about whether it would be a good idea to make a complaint about that nurse.
If you have any more questions about some of those scenarios or anything else in this webinar, please feel free to email either Claire or at the Oregon Sexual Assault Task Force website. You can find my information as well. I'm Nicole Broder. For those of you who are here in person today, you'll receive a CEU certificate for 2 hours emailed to you within 1 week. If you don't get that, reach out to one of us and we'll make sure that we figure out what went on. If you are watching this after the fact, recorded on our website, then there is a post-test available, and if you fill out the questions to that, then you will again receive a CEU certificate emailed to you. Thank you all of you for joining us today. We really appreciate it. We appreciate the work that you do. Again, feel free to reach out with anything, and have a wonderful rest of your day.